Suppose that we have our drug here flowing in the lumen of the blood capillary, and now it has to pass to the interstitial fluid. So it can act on the cell. We have our drug here in the lumen of capillary that must pass to the interstitial fluid, so it can go to the cells or act on the cells. The drug has to pass through cells in the wall of the capillary. These cells are called the endothelial cells. These cells are enveloped by a membrane composed of proteins. This membrane is called basement membrane. So again, our drug is now flowing in the lumen of capillary. To pass to the interstitial fluid so it can go to the cells, it has to pass through endothelial cells. These cells are in the wall of the capillary, and there is a membrane that is composed of proteins, and this membrane envelops these endothelial cells, and this membrane is called basement membrane. This section here differs according to the tissue. This section here differs according to the tissue, and this would affect how the drug is distributed in this tissue. Let's have a look. Here we can see that there are no spaces between adjacent endothelial cells. There are tight junctions between these cells. They are fused tightly together, and this would for sure restrict the diffusion of substance in the capillary to the interstitium. So, for a drug, there is no spaces between the endothelial cells where the drug can pass through them, and the only way for this drug to pass to the interstitium is by diffusion through the cell, not between them. So, our drug must be what in its nature? Yes, it must be lipophilic. So it can pass through the membrane or the cell membrane of endothelial cells. Okay, so in what tissue do you expect we can observe this type of endothelium? Yes, this is in the brain. And this assembly of endothelial cells, this is what we call the blood-brain barrier. But wait a second. Only lipophilic substance pass to the brain? Only lipophilic ones? So what is about glucose? It is the primary energy transport for the brain. But it's not lipophilic. Glucose is water soluble. How would it pass to the brain? Can you remember facilitated diffusion? It was a diffusion along with concentration gradient, but it was facilitated by carrier. This is what occurs with glucose in brain. It is transported through carriers or transporters called glucose transporters or GLUT. So, for a drug to pass through the endothelial cells of the brain, It must be either lipophilic, so it can passively diffuse through the cell membrane of the endothelial cells, or it has a carrier or a transporter on the endothelial cells. And that was the first type of endothelial cells. Let's have a look on the second type of the endothelial cells. Here we can see that these are, or there are, spaces between the endothelial cells. We call that spaces fenestrations, and through these spaces, water-soluble molecules can pass by, but they should be somehow small enough to pass through these fenestrations. So, proteins, for example, can pass, or if a drug bound to a protein also can pass. A drug bound to protein. Can you remember? Yes, the plasma proteins. If a drug bound to a plasma proteins like albumin, it can pass through these spaces. Okay, where can we find this type of endothelial cells? They are in the kidney. And that is the reason there are fenestrations in the endothelial cells of the kidney capillaries. They are not large enough to allow the proteins to pass. So we don't find proteins in urine. And if any pathology occurs here, we then see proteins in urine. So we know our kidney is injured. So it should be noted that a drug bound to plasma proteins don't pass here from the blood to the interstitium of the kidney. That means that a drug, to be excreted, it should be free and not bound to plasma proteins. Okay, now let's take a look at the last type of the endothelial cells. Okay, here we can see clearly that the spaces between endothelial cells are very big. It seems that anything can pass easily from or between these cells. Even proteins can pass. Where can we find the type of this endothelial cell? This is in the liver and spleen. And that seems logic. Liver is the organ of metabolism and detoxification. We want every substance in the blood to pass easily to the interstitial of liver so it can go to the hepatic cells. Also, this organ, the liver, is the one that synthesizes the plasma proteins and secretes them into the blood. So it makes sense that the plasma protein can pass through the endothelial cells of its capillaries. Okay, so in these capillaries, even plasma proteins can pass. Alright. Okay then. After we had learned about the different structures of endothelium of the blood vessels and how it affects the distribution of the drug, Let's take a look at factors affecting this trigger.